So it is good to see you. And so Paul introduced you a bit, but do you want to tell us where you're from?
I am from Roanoke, Virginia. I'm a retired CPA.
And if you could just tell me how long were you battling C. diff?
I was battling C. diff for 9 years. Um, I got it in 2015. Probably, I'm not sure where, a community acquired. Um, it came up when I was doing some painting with my husband, and I had diarrhea and a really sore abdomen. And from there, it took off, and I had a lot of recurrent infections over the years, treated with vancomycin.
And my understanding is that they kind of kept giving you vancomycin, but you weren't really offered anything different until very far into your journey. Is that correct?
That's correct. It was in 2023 when I had a hospital stay that really woke me up. And at that point, I decided things had to change. So I started investigating and found FMTs and VOWST, and went on to have two courses of VOWST and one FMT.
Wow, that was a lot, but that got you feeling back to yourself or close to it?
Yes, after the second VOWST, I haven't had another infection since then, and that was in 2024.
Well, I'm very glad that that's the case. But one of the things that we talk a lot with our volunteers, and you and I have certainly talked about, is the sort of emotional and mental effects that C. diff have on somebody like yourself, who has, spent the last 18 months or so, not having C. diff, but you still feel like sort of emotional and mental challenges in terms of getting back to the way you lived
Right.
before C. diff.
Um, Actually, when I was getting ready to start my second course of VOWST, I weighed only 86 pounds. And I was spent by that time. I was ready to give up. And I had decided if this course of VOWST did not work, that I was going to kill myself at that point because I was that far gone. But thankfully, it did work. And since then, I've done a lot of positive things. There are still things going on that affect me, though, like eating. I'm very limited in what I eat. Um, when I go to someone's house, I take my own food. When they come to my house, I will feed them the meal I prepared for them, but I have my own separate meal. I sit down and eat with them, but I actually eat a meal, a food separate from them.
Yeah, and so first of all, I'm very glad you're here. Having lost my mom to C. diff, I'm very glad that it didn't take you as well. Though I certainly appreciate how difficult the last 10 years have been for you. Now, we want to talk a little bit about, because we have an audience of a lot of healthcare professionals, we want to talk a little bit about the sort of positive and negative experiences of your positive and negative experiences with healthcare providers. Do you feel like the doctors starting in 2015, like, did they understand just how serious a toll C. diff was taking on you?
I do not think the people I saw at first did not. The gastroenterologist I saw of course, kept me on vancomycin, and we were on the cycle of tapering off and then getting another infection. And his main thing he said to me was I couldn't afford treatment. And then he said that FMTs had been curtailed because of COVID, and he didn't know of a hospital that did it. And besides that, I couldn't afford it anyway. I couldn't afford the deficit, which I did put on my credit card, and he was amazed at that. And then in the hospital, on one of my hospital stays, the nursing staff was not really helpful. I had to get on and off the bedside commode a lot, and they would be very short with me. They would yell at me. And one of them talked about my housekeeping hygiene, thinking that maybe that was the cause of my recurrent infections. So he was condescending in that way. So those experiences were not good. I did end up having good interactions, though, with the last physician's assistant that I saw, and she helped me a great deal.
Well, I mean, I'm very sorry that you had those experiences. I mean, I've had some less than stellar experiences with with healthcare providers. I think I think sometimes people become sort of inured or accepting of what they see in terms of patients getting infections, and it's like a coping mechanism. But certainly everyone deserves to be treated with respect.
Well,
and it sounds like that was lacking.
I'm sure they didn't come into work saying we're going to be short with this patient today, or we're going to yell at this patient today, but it just happens in the course of the day, I think.
I mean, I think it's a very stressful job, and a lot of times, particularly the nursing staff is understaffed. So yeah, I mean, that kind of stress can lead people to act out, but it's still not acceptable in my view. I think the interesting thing that I just want to touch on again for a second is the idea that the doctor was surprised that you would put fidaxomicin on your credit card. Yes. And I think that is sort of emblematic of, especially doctors that maybe don't see C. diff all the time and only treat it occasionally, is that they don't realize that this is a potentially deadly disease. And, when you've been sick for that long, or you feel yourself or your loved one is kind of in danger of losing their life, like there is no amount of money you won't pay.
Right.
And, so it doesn't shock me at all that you would have done that. One of the things, we have your full story on our website. I definitely encourage people to go and read it, because you have been through a lot. And I think that there's, particularly the healthcare providers that are watching this, can go and maybe learn some of the holes in the Swiss cheese that led you to end up suffering for so long. But can you tell me, like, why did you want to share your story? It's quite a vulnerable thing to do.
Because I wanted people who have C. diff now to know that they don't have to keep on courses of vancomycin over and over and over and keep getting reinfected, that there are courses of treatment to help them. And even if it's expensive, there are programs, patient assistance programs, that will help people. And I myself have benefited from that. For my VOWST treatments, I have not paid anything out of pocket. My insurance and the patient assistance programs have helped. And even with the deficit, after I put it on my credit card that once. Then the Merck patient assistance program came in and paid for it for me, and the medicine was overnighted to me. And I even sent my former gastroenterologist a letter explaining to him how the VOWST program worked and how the Merck Helps program works, and telling him how I had been treated and what happened to me. But I left him with best wishes because I wanted him, for his patients that he sees in the future, I wanted him to know that he could help them by using these resources.
Yeah, I mean, over the years, we work with all these companies, and there are certainly valid criticisms of our health industry and our pharmaceutical industry, but I have to say that we have always had very good experiences with connecting people to those assistance programs, and the company stepping up and helping people who genuinely can't afford to pay. So I'm glad you were able to find that. And we are going to have to go to our next session in a second, but I just want to say, Trish, that we are at Peggy Lillis Foundation. You're part of the family now, and we are very honored to have you be part of our family.
Thank you.
I'm so glad you're here, and I'm so glad that you're willing to share your story and help us to educate everybody.
You're
So
welcome.
I thank you very much.
I'm happy to be here.
Well, I will talk to you soon. Thank you so much again, Trish.
Okay, thank you.
Wow. Well, Trish, that was incredibly powerful. Just looking at some of the comments, all of us really appreciate everything that you said. And I think a lot of powerful statements you made, but to me, one of the most powerful things was that thoughtful note that you sent to the provider, who probably was frustrated that they weren't able to help you and probably didn't have the knowledge of access or what needed to happen to help you. And you educated that provider, and that goes a long way. So really thank you for doing that as well. You did the right thing all around, and so glad that you were able to access the treatment.